Healthcare services under the Aarogyasri scheme are set to face a major disruption in Telangana, and let's not forget, it's one of the flagship and even was there in undivided Andhra Pradesh. It's as old as that. Over 300 private hospitals empaneled under the scheme have announced an indefinite suspension of services starting Tuesday midnight. Their grievances, unpaid dues of nearly 1,400 crores from the state government. The Telangana Aarogyasri Network Hospitals Association, which represents 323 private hospitals, said the decision was taken after 3 weeks of failed talks with the government. Tanha President Dr. Rakesh, who's going to join us today, said that hospitals are crumbling under financial stress and verbal assurances are just not enough. Well, this is not the first time that Aarogyasri services have been hit. In January this year, hospitals went on strike over similar demands, which was called off after the government released 730 crores. But then the dues piled up yet again. Now, hospitals say payments are delayed by over a year under this scheme and by nearly 2 years under the Employees Health Scheme and the Journalist Health Scheme. Apart from pending arrears, Tanha has demanded a redrafted MOU, revision of treatment package rates, and a grievance redressal mechanism that can hold the system accountable. Doctors have warned the impact will be more severe in rural parts of Telangana, where 85 to 90% of families depend on Aarogyasri cards for cashless treatment. The strike threatens to leave thousands of low-income patients without any access to critical care. Now, let's understand that the Aarogyasri scheme was meant to be a lifeline for the Telangana's poor, but today it is gasping for breath. Hospitals are running out of patients and patients are running out of options. How long can a flagship healthcare scheme survive on just verbal assurances? And most importantly, when hospitals and patients are both left helpless, who takes responsibility? Like I said, joining us is Rakesh Vadiraju, President of Tanha. Rakesh Vadiraju, thank you so much for making the time and joining us on this broadcast. You know, you've been at it, like we just said in our introduction, that it's been months when you forewarned. And first time around 730 crores was paid, but then all the dues were not settled, Rakesh Vadiraju. How is it? You know, I'm seeing that I know that like we saw the Black Day of Engineers, you know, who said pay our dues or else, and of course the Deputy Chief Minister spoke to them and the issue was resolved. But in your case, what is the mean? Has anyone approached you from the government and said, you know, please don't do this because the rural Telangana will be majorly impacted? Isn't it right, Mr. Vadiraju?
Correct, madam. Good evening to everyone and
Good
good evening to you, madam. This is
Good
Dr.
evening.
Vadiraju Rakesh. I'm the state president for Telangana Network
Yeah.
Hospitals Association. I thank you for giving us this opportunity to explain the Aarogyasri, its scheme and implementation. 2007, as you said, Dr. Y.S. Rajshekar Reddy started this as a flagship program. So he wanted to help being a major necessity of the common man. And common man resides in the peripheral part of Telangana or any state. Percentage wise, 80 to 85% of the population which is under this particular scheme lives in rural areas. 10 to 15% are there in the city, Hyderabad city per se, or Rangareddy district in the peripheral part.
All those details, sir, we are flashing on the screen right now. You know, those are details. I want you, because I just want you to tell the viewers, when you say 1,400 crores, the pending dues, what are the dues, sir? Is it that hospital, what has not been paid so far? Is it the salary of medical workers? Is it maintenance of hospitals? What is pending, Rakesh ji?
Yeah, this particular scheme, as you said, is for BPL patients on a package system.
Yes, sir.
So every case that is admitted at my hospital today, operated, say, today evening or tomorrow, will be discharged on day 10, probably after suture removal, and the picture of that is being portrayed to the government or the trust through the Tanha portal, Aarogyasri portal. So this money from the claim process should be released to me in 40 days. Unfortunately, subsequent governments post Y.S. Rajshekar Reddy have delayed it by some months. Now, the present status is close to about 12 to 13 months of my old payments, which have done, say, for example, in the month of July or August, are getting released now. On an average, you require about 200 crores of money for running this particular scheme. And 200 crores is nothing but peanuts as far as the state budget is concerned. So this money I'm getting the cases for July of last year. So August to August is 12 months and this is 13 months. More or less, this amount is due. 1300, 13 months into 200 is about 2,600 crores.
That
So
is
if you
pending.
average it out to 2,500.
What about
Part of
redressal
it,
Yeah, what about redressal
part of
mechanism?
it needs to be paid to the government hospital, part of it to super
Yeah, I
specialty.
get that. But what about redressal mechanism? You also said that there is no redressal. You have met the minister, the health minister in the past. You've spoken to several representatives of the government. What happens? No one listens to you, or there are meetings, but there is no outcome?
Madam, there are two parts to this problem. Entire our agenda, what we have put forth is one, release of old dues, regular payments through a green channel, uh, redrafting of MOU. The MOU is the crux of the problem where they are trying to hide many things and not giving any powers to the network hospitals.
What are they hiding? I'm interested in what are they hiding?
For example, I'll tell you, madam, suppose some financial mismanagement happens at an hospital.
Okay.
The power lies with the trust to finance 10 times whatever is that problem that has happened.
Okay.
Suppose say I have collected 200 rupees, the trust can finance, say, 200 into 10, 2,000 rupees I have to pay. Now they are, as per the MOU, they are supposed to pay me by 40 days. Are they paying 10 times more the amount what I am supposed to get? They aren't. So the mechanism that they have put is a unilateral mechanism which should have been a bipartite and mutually agreeable for both of us. Unfortunately, in the
Dr.
haste of
Rakesh.
taking Aarogyasri.
Yeah, sir, my last question to you is that, this Aarogyasri, this is catering to the rural poor, sir. Families below BPL, below poverty line. They are going to suffer a lot. What is the way out? And particularly when it comes to critical care, where do they go? It is cashless transaction, sir. It is for the poor, sir. Now, what is it this time around? I mean, if you say, okay, pen down starting Tuesday, that is starting today, what is it that you need the government to do? Do you want it in a phased out manner that they solve your problems? Or do you say everything at one go, or else it is shut down?
No, madam, it's not like that. You need not have to look at. From January, we started a protest where we said the dues are about 800 to 900 crores. And the government, through the health minister and the concern, have assured us that they would pay us by about 4 months. I have waited for 9 months despite having a financial crunch, trying to get cash flow for my payment to the patients and the investment for the treatment to the patients in the form of drugs, anesthetist, consultant charges, so on and so forth. And now again, this time we have started from 20th of August, we have submitted a notice to the government saying that we are stopping services from 31st. So 10 days time we have given. If suppose they want to do any alternate arrangements, it is the responsibility of the government to do the alternate arrangements. They have started deliberations with us since 20th and it is now 15th or 16th of August, September. That is close to about 3 weeks. None of the promises have been met. Everything is status quo. Only thing they are trying to do is to derange our protest process in the form of giving a cake to a dog in the form of 100 crores release. This they have been doing consistently and they are not addressing the common problem. If they are not going to give money, from where should I get the investment to run my hospitals?
I hear you.
We,
You also,
we
Dr.
pretty
Vadiraju,
much know, madam, we have one more second. We pretty much know they are BPL patients. That's the reason we are withholding ourselves to give services. If our hospitals get sick, who has to treat them now? The question is that. Hospitals have become sick. That's what we are trying to tell.
Right. Now,
Sick units needs to be supported.
You're
If you
right.
don't support, we cannot come forward and give treatment.
Yeah, I understand that, but tell me something. In this, are there also, by any chance, where they are not paying, are there also preferential payments, which are made to certain hospitals maybe? I mean, does the pecking order change according to the choice and the whims and fancies of the authorities? It's just a question, doctor.
No, now they are saying, suppose, say, for example, there are a total dues of 100 crores,
Huh.
which actually the trust needs to put forth. What are the total dues? Total dues, if they are 1,000 crores and they have released 100 crores, I am supposed to get at least 10% of my dues. But when I check on my statements in the bank, I am getting only 3 to 4%. And that 3 to 4% is just evaporating for payments to various vendors, salaries, and other things. So unfortunately, by treating these BPL patients, the hospitals are becoming sick. 15% was the promise which they have asked us to give for Aarogyasri patients. But 85% is the occupancy of these patients in our hospitals. If 85% we do on credit, the 15% of the cash flow has to support this 85% plus the salaries of my staff, plus the taxes that I'm supposed to pay, plus the various other AMCs and CMCs. From where should I get this money?
All right. नहीं, एक आ गया है.
I am interested in serving my poor. But
Right.
if I get poor or I get sick, now who is supposed to treat me?